Good morning, everyone. It's a real pleasure to be here. Thanks to Emma and Tom for the invitation. It's really nice to be in a room. I can't remember the last time I spoke in a room with real live people, so fabulous. I am a researcher from the University of Stirling. My main area of research is actually dementia studies, but today I'm here speaking as a trustee of the Scottish Huntington's Association. So I'm going to tell you a little bit about the association because I'm not sure how familiar people will be with the work, and talk about how we're building support for change and talk about engaging with research in Scotland. So there are around 1,100 people diagnosed with Huntington's disease in Scotland, but Huntington's disease is, I have to get this right, an autosomal hereditary condition, which means it impacts the whole family and across generations. So we estimate around 4,000 to 6,000 people who may be undiagnosed or not yet tested for the condition, but also a wider impact on the family. HD is a progressive condition, as are many neurological conditions, so most people will end up needing full-time care towards the end of their lives. Because it's an autosomal hereditary condition, there's a 50% chance of a child inheriting the disease. So you can see how that impact kind of resonates through families. Symptoms come on between the age of 30 and 50, but that's very variable. That's just a rough estimate. And people will be symptomatic for around 10 to 25 years. So a very variable and long impact condition. The Scottish Huntington's Association. So we're here today to talk about participation, involvement, co-production. So SHA were set up in 1989, and written into our constitution it states that our chairperson must be a family member, and 50% of the board for SHA are family members and must be family members. So since the 80s, we've been living and breathing and working in that involved co-production way. When I came into the organisation from a university, I was kind of like, yeah, we need to do co-production. And then I realised that over half of the people in the room were family members and it was already going on and happening. So, I mean, it's really fabulous to see that. The main role of SHA is delivering support, care and treatment to families across Scotland. We now have an HD clinical specialist in every health board across Scotland. And we have a fabulous youth service which supports the young people in families with one-to-one support, with get-togethers, and then a summer camp where they all go off and abseil and skydive and do all kinds of exciting stuff together. We also have a financial wellbeing service. Because of the hereditary nature and the sometimes quite early onset of HD, it has implications on people's finances through employment, through accessing insurance and mortgages. So financial wellbeing is a really core part of what the organisation does. And we have clinical leads. Okay, I'm showing my age here because I can't actually read the writing on my paper anymore without taking my glasses off, and then that's going to be quite strange. So I apologise. The earlier slide was for the care services and the specialists that the SHA has across the country. And this slide is about our clinical leads. So these are people within core clinical posts in every health board in Scotland able to provide those really essential services for families. So we are big on campaigning at SHA, getting the message out, talking to people about what we do, raising the profile of the condition. And this is Gillian dancing in George Square, I think. Yep, so that was our dance-a-thon earlier this year, raising money and raising the profile of Huntington's disease. We've also had quite incredible success campaigning within the Scottish Parliament, and we're currently campaigning in Westminster. So our motion to the Scottish Parliament received support from 98% of the MSPs. We think it was the most supported motion that the Scottish Parliament has ever seen, and that was calling for better care and services for people with Huntington's disease. So lots of work going on in campaigning and raising awareness and talking about the condition. So in terms of research work, I think in the focus of the conference today, it's important to know that Huntington's disease has had some ups and downs in the research world. So there was, great excitement a few years ago with some drug treatments that looked incredibly promising, but unfortunately clinical trials have been halted for a number of reasons. So I think that shows the importance of having all kinds of research, so not just clinical trials, but research about how people live well every day with the condition, and other types of interventions and support that might work. But just to cover a few of the projects that are currently taking place in Scotland, and also to kind of prime for Gillian's talk coming up at the end of this trio, is to talk about 3 studies. So Enroll HD, HD Clarity, and Proof HD. So Enroll HD and HD Clarity are both big international studies with field sites all over the world. And the key aim of the studies is to generate data, to collect and generate and store huge amounts of data that other researchers can then go and access and engage with and utilise. So Enroll HD is an observational study, so it's about collecting data from individuals with HD and holding that data, and then other people can go in and use it. HD Clarity is about collecting cerebrospinal fluid and holding a bank of CSF fluids that again can be used by researchers around the world. So this is an example of work that somebody is doing at Glasgow University with data from the Enroll HD study. If you can understand the slide, then you're doing better than I am. As far as I understand, thanks, it's about understanding rare genetic modifiers or markers that might then lead to treatment. And then my final slide is a study that was undertaken in Aberdeen, particularly looking at the prevalence in Scotland, trying to understand the extent of HD in Scotland. That was a bit of a whirlwind tour of the organisation and what we do and what we're hoping to do, but been really interesting to speak to you, and the others will add some more colour and detail. Thank you.